Hello everybody, this is Dr. Kevin Connors in Autoimmune Basics 101. We're going to talk about um, basic immunology, basic understanding of autoimmune theory, and what we're trying to do to help a person with autoimmune disease. Um, a lot of things to go over here today, so let's just jump right into this. Giving credit where credit's due, Dr. Tatis Karatsian, my mentor, um, in all of this as well. So, stages of autoimmune disease. It's important to understand this. The three different stages. First is silent autoimmunity. Don't know that you have autoimmune. You don't have any symptoms of autoimmune disease. You have no tissue destruction. But if you do a blood test, you show elevated antibodies. So you can show elevated antibodies to self-tissue and yet still not yet have any symptoms or loss of tissue damage or anything like that. And we'll explain as you go, as you understand the immune system, how that is even possible. Stage 2 is you're having elevated antibodies, but you're now having the start of symptoms, but no real noticeable loss of tissue or no horrible damage to tissue at this point. So you're starting to get sore hands or tiredness and fatigue, but no real loss of tissue. In case of a thyroid patient with Hashimoto's, they're starting to get symptoms, maybe hair loss and some fatigue and some difficulty losing weight, but still their thyroid numbers are within normal range. So they're still getting adequate supply of thyroid hormone. It's just that they show positive TPO antibodies and symptoms of low thyroid. Stage 3 is you have elevated antibodies, you have the symptoms, and now you have measurable tissue destruction. Staying with that same Hashimoto's example would be now your T3 is very suppressed, your T4 is suppressed, your TSH is elevated. You might have other thyroid blood tests positive as well, and now we have to do some thyroid replacement or stimulation with nutritional things and things. So we already are in stage 3. The Hashimoto's, the autoimmunity is damaged the thyroid gland and now is not putting out what it should put out. So different stages of autoimmunity can vary. You can stay in stage 3 with tissue destruction. You can move from stage 1 to stage 3 literally overnight. You can stay in stage 1 for decades, never move to stage 2, never move to stage 3. And the goal in treating a person with autoimmune disease is not to have them, take this person on in stage 3 and think that they're not going to have autoimmune disease. The goal in treating autoimmune disease is to get them into a more silent state, is to get them into a state where they may still already have tissue destruction, yes, but you're calming down the immune response. You're not getting continued tissue destruction, and you're calming down their symptoms. So you're really moving them backwards in a way and trying to keep them in a backwards. You're basically trying to manage this to try to keep it in an autoimmune reactivity state or in a more silent state, and teaching the patient how to understand this and how to manage it and self-manage it. That's really the goal in treating autoimmunity. It's not in making autoimmune disease go away. So how do you know you have an autoimmune disease? Well, you really test for antibodies, but there are some clues. So there's some clinical red flags for a practitioner. These are red flags for you as a patient as well. I've tried everything and nothing has cured my complaints. Various treatments have helped at times and then it made it worse. That's a real common thing. Let's say if they have Lyme disease, I was on, cat's claw and it seemed to help for a period of time and then it just made it worse. That's a good chance you're in an autoimmune phase. If you're using Th1 immune stimulants and it's making it worse, that's a good chance you're in an autoimmune phase. If you have multiple adverse reactions to foods or chemicals, I can't even go into a new building. The smell of a new building just makes me sick. You're overly sensitive to mold. I have tons of food sensitivities. That's a good sign you have self-antibodies. You have a number of diagnoses. You've been to 20 different doctors. That's your one of your best indicators. You have an autoimmune disease that has not been diagnosed or has not been adequately managed. So when we see a person that's been everywhere and nobody can figure them out, it's most likely an autoimmune disease. They have a large file of labs, countless bottles of supplements. They have cupboards full of supplements that they've tried because they read something on social media that this is the cure for this symptom. They try that, it just doesn't help. Nothing seems to help them. Or they're diagnosed already. All right, they already know they have a disease, but nobody's ever told them their hypothyroid is actually Hashimoto's, or that their diabetes, they thought it was type 2 diabetes, it could actually be an adult onset type 1 diabetes. You could have antibodies to your islet cells in your pancreas, and that's really the cause of the diabetes. Inflammatory bowel disease, but it actually could be antibody related. So all these diseases can have an autoimmune component to it, and people have never been diagnosed with this. So those are red flags you're looking for. And what you're trying to do from a clinical standpoint is, number one, help identify an undiagnosed autoimmune patient, help them identify the different stages. Remember, stage 1 is silent, stage 2, autoimmune reactivity, and stage 3, full-blown autoimmune disease where you have tissue destruction. And then the biggest thing that we're going to be working through with this course is learning how to identify lifestyle triggers, because this autoimmune disease is there. You're going to have antibodies that will be there most likely for the rest of your life. You have to know how to manage it. You need to learn how to manage the triggers. Is it lack of sleep? Is it exercised too much? Is it that I have emotional issues? Are there food triggers? You're identifying dietary triggers. So different proteins in different foods you can develop antibodies to, and that will, once you eat that and you stimulate an immune reaction because of that antibody that you have for gluten, let's say, then it fires up the rest of your whole autoimmune cascade. So you have antibodies to gluten, you eat that, it fires an immune reaction. You also have antibodies to your thyroid, Hashimoto's, it's going to fire an immune reaction there. You're going to kill that which you have antibodies against first. You're going to damage self-tissue if you have self-tissue antibodies. So understanding dietary triggers is super important. I can't tell you how many Lyme patients that I've talked to that are in stage 3, phase 3 Lyme, with autoimmune Lyme, and they don't know it. And they actually have antibodies to neural tissue. And because they don't know it, they don't think that their food antigens really cause any problems. They're not going to change their diet. Well, every time they eat something, maybe they eat, let's use gluten as an example. Maybe they eat gluten and it doesn't cause any stomach ache, but it causes foggy thinking. And they can't put their finger on it because they eat gluten every day. And they say, well, I have foggy thinking all the time. I can't even think straight. I can't get out of bed. I feel achy. I have all this inflammation. It's not gluten. I tried to stay away from it one time and it didn't help. Well, you have to identify all these dietary protein triggers. Might not just be gluten. Maybe it's gluten and nightshades. It's gluten and lectins. Maybe it's dairy and scallops. You have to test for these things, because if you don't get rid of them, you are firing literally a burning fire in your gut, whether you feel it or not, that's going to fire this immune response elsewhere. And you will kill that which you have antibodies against first. So you will start destroying self-tissue when you have self-tissue antibodies. So you have to identify these triggers. So just ignore it. If a patient says that, well, I don't have gut issues, I know I don't, so I know I don't have food allergies. If they have autoimmune issues, they have food sensitivities, I'll guarantee it. They have antibodies to foods. You have to test for that and find that. And then identify chemical triggers. It can be pollutants, can be chemicals that they're using in their hair products. It can be chemicals that you're using in your lotions. It can be cleaning products in your house. It can be something your husband is spraying on the lawn. These are all triggers that fire an immune response and can have a delayed response. So it can be days or even weeks later after exposure, and now you can't get off the couch. So you have to look and dig. You have to be an investigator. You have to put on your Sherlock Holmes hat if you have an autoimmune disease. Identify other active antigen triggers. Those are pathogens. Are you exposed to a virus or a bacteria or parasites or mold? You can't get a person better if they're in a mold house and they have an autoimmune disease. That mold exposure on a constant basis is firing this immune response, and you will damage what you have antibodies against. So you're going to fire that autoimmune self-antibody response, and you're going to have inflammation in your body. You have to identify a breakdown of your immune barriers. So your immune barriers, your barriers in your body, your gut barrier, your lung barrier, nasopharyngeal pharynx barrier, your blood-brain barrier, your skin barrier. These are barriers that keep pathogens out of your body, that keep bacteria out of your body, that keep bad chemicals that you shouldn't be absorbing through your lung barrier, your gut barrier, things that shouldn't be crossing your blood-brain barrier. You need to work on supporting those barriers and healing those barriers. And then identifying mechanisms to improve immune tolerance. We're going to talk about that a little bit more in this presentation, but immune tolerance is very important, stimulating your Treg cells. Keeping a balanced Treg system so that you're not overbalanced Th1 or overbalanced Th2. Then identify strategies to recover from flare-ups. This all has to do with lifestyle and diet and the proper nutrition, proper exercise, proper lifestyle. So you can see, this isn't easy. Dealing with autoimmune issues isn't easy. If you go to a practitioner that says they have the simple solution to autoimmunity, you should turn and run as fast as you can, because there is no simple solution to autoimmunity. You have to look at a lot of different things when you're dealing with this. There's multiple immune factors in autoimmunity. You can have depressed white blood cell production leading to immune dysregulation. You can have an active infection, meaning that you have a current viral load, a current bacterial load, mold load, spirochete with Lyme disease, an active pathogen that's upregulating the immune system. You can have barrier permeability that we talked about, overactive phagocyte cells, monocytes, neutrophils, eosinophils, basophils, macrophages, dendritic cells, Kupffer cells, and microglia in the brain. Huge problem is microglial damage. I have a video on microglial damage. Make sure you watch that as well. Loss of your complement protein system. Your complement protein system is literally your immune landmines throughout the body, sitting there to kill pathogens. But you could have a loss of balance in that, and you could have an upregulation of that or a downregulation of that. You can have an overactive complement protein system or an underactive complement protein system. An abnormal T cell differentiation, your overbalanced Th1, your overbalanced Th2. What we're seeing more and more is overbalanced Th17, this hyperinflammation response. You need to balance it with your Treg cells, your Th3 cells, to help stimulate regulation and help stimulate support to balance out your T cell differentiation. Different dysfunction throughout your immune system, chemical-induced immune dysfunction, abnormal microbiome, we'll talk about that a little bit, and the psychoneuroimmune promotion of an immune dysregulation. You see this very common with Lyme disease, much more so than with some of the other autoimmune issues. Brain injury, traumatic brain injury in itself can cause an autoimmune disease and cause damaged microglial cells and prime microglial cells. It gets very complicated, as you can see. We're not just talking about the individual immune cells when we're dealing with an autoimmune situation. It isn't your immune cells gone awry. It's something that's happened to your immune cells, exposure to different things, that your immune system is reacting in a way that is really actually normal for that thing, but you were never supposed to be exposed to that thing. So let's first talk about some permeability of the barriers in autoimmune disease. So you have your lung and your nasopharynx and your epithelial barrier of your lung. But when air pollution, you got cigarette smoke, you got infections that can enter your body that way. Certainly chemicals affects your glutathione production, oxidation and redux of your glutathione support system there. Eventually, if there's constant irritation, let's say in the use of constant cigarette smoke, you're going to have breakdown of your glutathione antioxidant system, and that's going to damage cells. You're going to have opened up cells. Instead of having those tight junctions of the cells, you're going to have separation, damage of that barrier, and then things are going to get across the barrier that never should have gotten across the barrier. So understand, a barrier is like a fence. The barrier in your lungs and your nasopharynx is not much different than your intestinal barrier, and it functions the same, though it's totally different cells, with your blood-brain barrier. So the epithelial barrier in your lung and your intestines are very similar, and those can separate and break because of cell damage, and things get across that never should have gotten across. If you watched the video yet about foods and why you test foods, I explained that a little bit more deeper, that the proteins, as they break down into peptides and then ultimately down into single amino acids that are supposed to go across the intestinal barrier. When you have a damaged intestinal barrier, things get across that never should have gotten across. The gaps between the cells are much larger than if you had a healthy barrier there, and that's where we start to develop antibodies, because things get across that never should have got across. Our immune system looks at them and actually functions normally in trying to kill that thing. But if that thing is a chemical, or that thing is a peptide of a food, or some pollution, or some toxin of some sort, it's not going to die. So your immune system is trying to kill this thing, makes antibodies against this thing. Now you have circulated antibodies against food peptides. Now every time you eat that food, you're going to fire an immune response. So damaged barriers is super, super common. I mean, this is just, you don't even need to do a gut barrier test to know if you have a gut barrier damage. If you have an autoimmune issue, if you have issues, health issues that you're unable to resolve and is making your life miserable, you have to just assume that you have damage to these barrier systems. And if you have upper motor neuron issues, meaning head issues, brain issues, certainly even symptoms in the rest of your body can be coming from your brain. Your parietal lobe can cause, if you have inflammation in the parietal lobe of the brain, it can cause a sensational issue anywhere else in the body, meaning I could have the sensory of knee pain, but it's actually caused from my parietal lobe in the area of where my knee, the afferent connection of my knee connects to the brain. So I can think my knee is killing me because my knee is actually really killing me, but it's actually caused from inflammation in the parietal lobe at that area of the knee in the parietal lobe of the brain. So a lot of upper motor neuron issues, a lot of sensory symptoms that we have, a lot of motor issues that we have are really from inflammation in the brain, and it's a damaged blood-brain area, blood-brain barrier, and that blood-brain barrier is made up from astrocytes in your brain, and those it's very difficult to heal. So you have to be, knowledge of that had to be even more specific and concerned with what you're exposed to. So it does have to boils down to a lot of lifestyle changes, but understanding the barriers and trying to heal the barriers and protect your body, knowing you have damaged barriers, is one of the key to managing autoimmune disease. Here's just a picture of the barrier in the lungs. The barrier in the center is the barrier in the gut. and the blood-brain barrier on the right, on how things can get across those barriers that never should have got across those barriers when there's damage to that barrier. And then our body makes antibodies to those things in an attempt to kill them. But if they're not things that can kill, that can die because they're not living organisms, now you got circulating antibodies, and you got this this immune reaction to these things in an attempt to kill it. And if you already have self-antibodies, any immune reaction for any reason is going to, increase the likelihood that there's going to be damage, more damage to self-tissue. And this is what, sends people, to the couch because they can't cope with life. And it really has to do with the barrier system to somebody who that's damaged, and stimulates an autoimmune reaction and makes them worse. So this is where you got these cyclical changes with autoimmune disease. They might feel better for a period of time, and I don't know what I did. It wasn't anything that I did. I just, and then they crash. You got to work on all these things at the same time. You got to work on healing these barriers. So understand, you have innate immunity and adaptive immunity. There's a few different ways to classify this. We're going to go through a couple different classifications. Your innate immunity is really how you deal with something like an acute infection. Your natural killer cells, your mast cells, are going to really fire first and cause a reaction to stimulate a bunch of cytokine production. Histamine is going to be brought into the area to pull in natural killer cells. Natural killer cells are there to kill. They're your number one killers of a bacterial infection or a viral infection is your natural killer cell response. You got your wandering dendritic cells and your macrophages. Over time, they'll wander into the area, into that tissue site of infection, and they will help through phagocytosis kill a bacteria or a pathogen also. But then they also, the dendritic cell functions as an antigen presenting cell to basically present to the B cell, here is this antigen that we're trying to kill, that we're having difficulty killing. And the B cells make antibodies, stimulate a T cell response so that you have other killer cells in the area through communication with these chemicals called cytokines and chemokines. And then your antibodies that are made by the B cells are then attached to the antigen, so your natural killer cells and your lymphocytic T cells can identify them and kill them. So that's how your immune system works. Another kind of picture of this in the center of the screen is an antigen. So think of an antigen is that's what your immune system is trying to kill. So normally an antigen should only be a pathogen. So normally an antigen should only be a pathogen, meaning a living organism, a virus, a bacteria, something like that your immune system can kill. So remember, you have two types of systems that get rid of things in your body. You have your detoxification pathways, in which you're supposed to get rid of chemicals, and then you have your immune system pathways, in which you kill bad guys. So the immune system isn't supposed to fire against non-living things, but non-living things aren't supposed to be entering into your body. But when you have a damaged barrier, remember, you end up getting peptides of foods that never should have made its way into the bloodstream, is now into the bloodstream, and our immune system is firing a reaction against this as if it is an antigen, because technically it is an antigen when our immune system fires a reaction against it. So anything that your immune system is attempting to kill is an antigen. Again, antigens should only be pathogens in a perfect world. But when antigens are heavy metal, let's say that antigen is mercury right there, and you're going to fire an NK cell, natural killer cell response to it, is it going to kill mercury? No. So what happens? Your T helper cells are trying to stimulate a bigger NK cell in a cytotoxic T cell response. That's a little bit farther down on that red line. The T helper cells are upregulating the natural killer cells, are upregulating the cytotoxic T cells so that they can fire a more prominent attack against this bad guy. But if this bad guy is a non-living thing, let's say mercury, then it can't kill it. So you can't kill this thing. And then your T suppressor cells over on the left are trying to calm down the T helper cells. Your T regulator cells are trying to regulate this whole process and orchestrate this whole process. The antigen can be grabbed onto by an antigen presenting cell, that APC, and presented to a B cell in order to make antibodies against it. And this is how a cascade can take place. If this mercury settles inside the cell or attaches to receptors on the outside of a cell, your B cells can actually make antigens, can make antibodies against self tissue. This is what can predispose, this is what can cause an autoimmune disease in the first place. If that antigen is Lyme, Burgdorfia, Borrelia, and your immune system is unable to kill it, and that antigen, that Burgdorfia, goes inside the cell or attaches to the receptor of a cell membrane, trying to hide and protect itself, your B cells can make antibodies against the cell tissue of the cells that this is attaching to, this receptors that it's attaching to, or the cells that it's hiding in. This is how an autoimmune disease begins. So again, the definition of an autoimmune disease is that you have antibodies against your own cells. Not a good thing. Well, how does it happen? That means our immune system has gone awry and it's a bad immune system. No, it's actually your immune system is doing everything it's possibly can do. It's that thing is either tricking your immune system to make antibodies against its own tissue, in case of autoimmune disease caused from a pathogen, or it's an autoimmune disease caused because of toxicity, that your immune system is making antibodies against self-tissue in the hopes to basically kill that tissue and thereby get rid of that pathogen, get rid of that antigen, whatever it is. So, kind of complicated. Might have to go through that several times, but this is how your immune system kills things. It's a good thing. It's not a bad immune system. It's trying to kill things. Problem is, if it's trying to kill things that aren't killable or aren't easily killable, that's where we have a problem. So here's another picture, better graphic maybe. On this side, the Th1, this picture, the Th1 side is on the right, the Th2 side is on the left, doesn't make any difference. And that Th3, that conductor down in the center, he's the Treg cell. He's trying to balance this whole thing. So you can see, if I have a full autoimmune disease, the more support I could give to my Treg system, my Th3 system, to balance this all out, it's going to help calm down my symptoms. So this, we could talk about this slide for about an hour, but I won't go into any more depth of that. When we look at a white blood cell panel, this is typically what you're going to see. This is a CBC with differential. So you got white blood cells, that's your total white blood cells on the top. Then you got red blood cells, hemoglobin, hematocrit. Let's go down to the white blood cell separation. You got neutrophils, monocytes, basophils, and then the absolute neutrophils, monocytes, eosinophils, basophils. These are your phagocytic cells. This is your innate. This is your immediate response cell that's trying to kill a pathogen. And then you have your lymphocytes, your adaptive immune system, your total B cells, your T cells, and then your natural killer cells that are killing off your pathogens that you're exposed to. Then we have the function of other chemicals in our body. The NF-kappa beta, that's nuclear factor kappa beta, is a hyperimmune response. That is, understand, anything in your body is not bad or good. It's all about balance, all right? So NF-kappa beta has a function in your body to stimulate an immune response. The problem is you could get on what's called an NF-kappa beta amplifying loop. So it's an imbalance that makes something bad. So go up to the top left of this picture. You got inflammatory cytokines, inflammatory pollutants causing environmental pollutants causing inflammatory cytokines, dietary peptides, meaning you have a sensitivity to a food, you have antibodies to a food, or you have any antigen of any sort, is going to activate your NF-kappa beta system. It's to activate an immune response. That's what NF-kappa beta is for. It's to activate an immune response. It's to stimulate your Th1. It's to stimulate your Th17. Those are all good things. It's when it's out of balance that is the problem. So if I have an autoimmune disease and I'm constantly exposed to food peptides that I already have antibodies against, meaning, simplify this. If I have an autoimmune disease and I don't know if I have a gluten sensitivity, but I do. Let's say I have antibodies to some gluten peptides, and I'm continuing to eat gluten. What that's going to do, it's going to be constantly activating NF-kappa beta, just looping that every time I'm eating that thing. It's going to just stimulate either Th1 or Th2 dominance, depending on the person. It's going to be stimulating my Th17 system, which is going to be hyperinflammatory. It's going to be activating systemic inflammation. It's supposed to say systemic on the bottom. It's going to be activating a systemic inflammatory response. It's going to be activating intestinal tight junction breakdown. It's going to be damaging not just intestinal, but lung and other barrier breakdown. It's going to be it's going to continue to stimulate. This constant inflammation is going to continue to break down my barrier systems. And then that's going to, in turn, stimulate autoimmune activity. So if I already have antibodies to my thyroid and I am, exposed to environmental pollutants or exposed to foods that I already have antibodies against, or exposed to some environmental antigen, or even exposed to viruses and bacteria, it's going to make my autoimmune situation worse. It's going to stimulate destruction, in this example, of my thyroid gland even more so. Can't figure out why I'm even more tired. I'm still taking, I got to check my thyroid dosage. My dosage might be off, but then lets you go to the doctor and get your blood tested. Your T3 and your T4 and your TSH are still within normal limits, and I don't know what's wrong. It's because whatever you did that day stimulated this reaction, stimulated an overabundance of inflammation that stimulated an autoimmune activation. This gets complicated, doesn't it? This is depressing. It gets very complicated. But you have to know these things as a patient. You have to know the things that are stimulating your immune system and things that could block it. You notice in the center of the screen, resveratrol and curcumin have been shown in studies over and over and over to help block the NF-kappa beta loop. We could also add green tea extract, most of your flavonoids to that. So there's things that you can do. I'm just going to take these supplements and that's going to be my solution. It doesn't work that way. You have to deal with all these stimulating factors to calm this whole thing down. And that has to do with this whole concept of self-tolerance. You have a loss of self-tolerance. The more things that you're exposed to that is disrupting your immune system, different toxins and pollutants. It's never just one thing. Some people think, I just have this problem. It's because of my Lyme disease. It just is not. It's never one thing. It's a cascade of things. The more aspects that you can deal with as a patient and learn to self-manage, the better you're going to be, because it's a combination of multiple things that cause this immune dysregulation and just complete loss of self-tolerance, and this is when people crash. So then you end up with the production of self-tissue antibodies, and if you have the presence of, you look at the left of the screen where you have lower tissue amount of NF-kappa beta, a higher amount of Th3, remember that's your Treg cells, and a lower amount of Th17, which is going to be hyperstimulation, which if it was higher, it'd be hyperstimulation of inflammation. So you have lower amount of inflammation, greater amount of Treg cells, a lower amount of NF-kappa beta inflammation. You're going to stay more in a silent immunity, silent autoimmunity. But the greater amount of inflammation you have, the less regulation you have of your immune response, you're going to end up with more damage. So this is a good slide to memorize, because this is going to be good to help balance things. And then there's the whole concept of understanding how your microbiota helps balance this and stay in place. There's a number of studies that are out that show a healthy microbiota, that's the healthy flora in your gut, in your lungs. You have microbiota throughout all your body, even on your skin surface. The healthier you can keep that through eating good food. That's the number one way you increase the health of your microbiota. It's not taking probiotics. It's eating good, balanced diet. That is gonna protect your barrier. That's gonna protect against pathogens. That's gonna decrease inflammation, overall inflammation. And again, you think, well, I'm just gonna start taking a probiotic to get a healthy microbiota. What you have to do, honestly, you have to start by what's damaging my microbiota. And what is your biggest thing that damages your microbiota? Inflammation. Well, where do I get the most inflammation in my gut? From food. From your food, not just poor food choices, but eating foods that might be actually good foods that you have developed antibodies against. So if I have antibodies against casein, dairy, and I continue to eat dairy and I don't have any symptoms with it, you're causing inflammation in the gut, unhealthy microbiota, an increased inflammation systemically, and an increase upregulation of an autoimmune response and damage to self tissue. I don't care if you got gut problems. So important to keep your microbiota healthy. And then the psychoneuroimmune response is so essential. We talked a little bit about the microglial damage that can take place with autoimmune disease. Really have to go back and watch my video on neuroinflammation and microglial damage and how microglial cells can become primed and then just become sitting there and spewing out inflammatory cytokines. But there's other cascades that take place that cause this without having the full-blown antibodies to neural tissue. Your immune system response in your gut or in any barrier area is going to stimulate cytokines that are going to directly affect the immune system in the brain and directly upregulate microglial activity in the brain. Stimulation of the vagal nerve through irritation to the vagal nerve and damage to the vagal nerve in the gut is going to cause direct damage to the brain as well. If there's damage to the gut and inflammation in the gut, that's going to cause an imbalance in neurotransmitters. That affects the brain. Direct brain effect with the amygdala and through the HPA axis. Direct is going to affect hormone function, is going to affect your whole body, and it's certainly going to affect the neurons themselves. So there is just such a cascade of problems that happens when we talk about autoimmune issues that it's just not a simple thing to deal with. You have to look at as many different factors as possible that if you're going to really see success in dealing with autoimmune disease. So we can go through these again. We talked about this slide already. These are things that are taking place. Some people could have, depressed white blood cells and loss of complement system and chemical binding to tissue protein. Some people that is their major issue. Some people's major issue is their microglial system in their brain and the inflammation in the brain that's causing an imbalance in the HPA axis and causing an imbalance in hormone production, and fatigue is their main thing. Some people are going to have an abnormal T cell differentiation and they're just hyper Th1 and that is their main thing that they're dealing with, and just calming that down and stimulating Tregs is going to be the biggest thing that's going to help balance them. The idea is that every single person is different with autoimmune disease. They're going to have a very personalized combination of things that are causing dysfunctional patterns in their immune system. You as the patient have to educate yourself, and you as the patient, the responsibility ultimately falls on you to see where your triggers are and find your triggers. I would rather have you spend your money in testing and figuring this stuff out so that you can better manage your lifestyle. But ultimately, the responsibility does fall on you as the patient to then make the lifestyle choices that are going to help you. And these are, I'm not trying to make light of these. It's difficult. It's hard to stay on a gluten-free, dairy-free diet. You know, it is really hard to stay on a autoimmune diet. It's really hard to stay away from these foods that everybody else seems to eat with no problems. When I eat them, I get brain fog and all sorts of problems of anger and whatever it is. So it's very difficult. But the more ways that you can see how you can deal with this cascade of problems that you're suffering from, though it's very complex, the more ways that you can see, okay, if I need to balance this, I need to balance this, is where you can find what's going to be a perfect balance for you to try to move you from stage 3 full-blown tissue destruction to, hey, now I can live my life a little bit, and my symptoms have calmed down. So that's what we're trying to do and educate you with all of this. I know we went through a lot of information in just 40 minutes here. You might have to listen to this a couple times, but know that we'll be praying for you. Know that we're going to be constantly adding educational information so that you can better self-direct your care. Thanks. Bye-bye.